So, how many of you think about an egg sizzling on a hot frying pan when I say psychedelics? How many of you think about tie dyed hippies dropping acid, maybe jumping off of tall buildings? All right, okay, cool. I'm playing to the right audience here. Um, so, for those of us who were born after the 1960s, our impression of psychedelics has largely been shaped by these powerful images of ruined lives and damaged brains. Campaigns like Just Say No, or the school programs DARE, the Drug Abuse Resistance Education Program, have reinforced these messages of abstinence when it comes to so-called hard drugs like cocaine, heroin, psychedelics, and sometimes even cannabis. But research has shown that education has not effectively stopped teenagers from having sex, nor has it reduced drug use. Historians estimate that since the 1970s, around the same time that United States President Richard Nixon introduced a war on drugs, the US government spent over $1 trillion fighting that war. Fast forward to today, and the war on drugs amounts to about $9 million of spending each day to keep drug dealers behind bars. Now, in many ways, the war on drugs has failed, not only because it's been expensive, but in criminalizing certain classes of drugs. The war has justified the mass incarceration of Black and brown people while stimulating racist stereotypes about what a drug user looks like. Now, there's a deep irony embedded in this history. While medically approved pharmaceuticals have filled our medicine cabinets like never before in human history, drugs associated with street use earned their consumers serious jail time. And today, we're living amid the most serious drug crisis in history, commonly referred to as the opioid epidemic, and at its core, substances like fentanyl and a whole range of opiates come from pharmaceutical products that have been approved for use as medicines. Alongside negatively stereotyping an entire group of people, the war on drugs has had another unfortunate consequence, which is that it relies on simplistic messages to explain complex reactions, and our public perception of drugs and addictions has been grossly misinformed as a result. And by that I mean, some of our expectations and even some of our policies around drug use continue to rely on assumptions that medically approved drugs are good and other drugs are bad and may fry your brain. We know that is not all the whole story, because some of you put up your hands and are still here today. In 1971, when the United Nations placed psychedelic drugs like LSD or acid, MDMA or ecstasy, or psilocybin or magic mushrooms into a category of dangerous drugs, we were expected to accept that these drugs were harmful and we needed to stay away from them. Any of us wanting to find out more about these tantalizing subjects would have to walk over to a library and sift through books and articles to draw our own conclusions, or ask your friends. Today, as we question these drug policies, the way we gather information has drastically changed with the advent of the internet. We are constantly faced with decisions about what information to trust on social media, podcasts, and as well as listening to our friends and watching regular news sources. The information we can seek out today is even more complex and accessible than ever before. So what do we do? Who should we listen to? And what information is correct? I suggest it's time to flip the script. It's a time to end the mantra of just say no and embrace a new era of just say KNOW. Just say no. I'm a historian of psychedelics. For the past 25 years, I've been studying the use of plant-based psychedelics like the peyote cactus, psilocybin mushrooms, or the Amazonian brew ayahuasca, alongside synthetic products like D-lysergic acid diethylamide, LSD or acid, and 3,4-methylene dioxymethamphetamine. You can just call it ecstasy or MDMA, or E if you prefer. These are amongst the most common psychedelics, but their historical roots and practices vary considerably. Some of these substances, like peyote and mushrooms, have deep connections to indigenous ceremonies and healing rituals, including ceremonies with deep roots right here in Saskatchewan. Others, like LSD, attracted serious attention in the 1950s amongst Western psychiatrists who found promising results using LSD and mescaline to treat alcoholism and a range of serious mental disorders. Indeed, it was Saskatchewan that was home to some of the most significant clinical trials in the world in the 1950s, many of them based right here at the Saskatchewan Provincial Mental Hospital at Weyburn, and some that occurred down a hallway. But over the course of the 20th century, both the Indigenous and medical practices came under threat. Successive governments have attempted to extinguish Indigenous practices, including ceremonies that might threaten a Christianizing mission. Meanwhile, psychedelic therapies in the 1950s were based on the idea that a single-dose therapy in a safe space, surrounded by experienced therapists, could result in a life-changing outlook. But this single-dose therapy competed with the onslaught of daily dose pharmaceutical pills, remedies that soon overwhelmed psychiatric care. In fact, some of the most addictive and harmful drugs in circulation today are those extracted from common products sold at pharmacies. We've seen this before with pharmaceutical products like cocaine, morphine, benzodiazepines, and now opioids, including fentanyl, which started as prescribed medicines and became some of the most abused and addictive substances on the planet. With alarming rates of addiction and overdoses occurring throughout North America, it seems clear that the war on drugs is a losing battle. The World Health Organization estimates that over 500,000 people die each year from drug overdoses. Just saying no is not working. Some jurisdictions are beginning to change their approach by reducing harms and focusing on promoting safer supplies. And that doesn't just apply to opioids. Here in Canada, for example, cannabis is now sold openly and legally in corner shops. Harm reduction advocates suggest that safe use is a better way to minimize the dangers of consuming drugs than to naively suggest that abstinence is the answer. I suggest we need to embrace a new era of just say no. But what do we know exactly? Psychedelics are not going to end the fentanyl crisis. Legalizing psychedelics is not going to remove all of the potential harms. But if we're willing to change the script, we might be able to move past the idea that there are bad drugs and good drugs. We might be able to think more creatively about why people consume these substances and consider what we might learn from those people. Take peyote, for example. For hundreds or even thousands of years, it has been consumed as part of Indigenous rituals, part of fostering community and enhancing spirituality through healthy practices and lifestyles. Flipping the script means paying attention to this history and learning the truth about Indigenous practices that have been aimed at improving mental health or confronting intergenerational trauma through ceremony. If we come back to the clinical example, studies in the 21st century suggest that psychedelics might offer new pathways for treating mental illnesses. Despite claims that psychedelic-assisted therapies provide new ways to confront treatment-resistant disorders, whether that's major depression or post-traumatic stress disorder, there are still risks involved. Psychedelics are not magic bullets. They do not work for everyone, and therapeutic settings create their own risks, from sites of past abuse to spaces that are inaccessible to many people due to cost or location. Just say no means getting past the idea that psychedelics can either fry brains or fix them. So instead, I want us to recognize that there's a more dynamic history of psychedelics that can give us an appreciation for a wider set of cultural practices that people have used around the world and throughout time to manage difficult situations, whether that has been individual pain relief or treating existential angst associated with climate change. We don't all have to drop acid to change the way we think. We might even start small by asking ourselves, why were psychedelics prohibited in the past while Indigenous communities struggled to retain sovereignty over their traditional healing practices? We might ask ourselves why patients in treatment-resistant categories are lobbying for access to psychedelic-assisted therapy. And we might even ask, who stands to benefit from deregulating psychedelics? If we can get past the popular assumptions about psychedelics, we might be able to retain the magic in the mushrooms, so to speak. If we can do that, I think we might be able to enter a new era of drug awareness and policymaking, an era of knowing. Thanks.